So what happens when the healthcare system lets you down? Well, for one person in Tracy, California, it wasn't just a bad day. It was the spark for a full-blown investigation. And we're not talking about some fancy report from a university. No. This whole thing started with one man's incredibly frustrating and painful trip to the ER.
Just try to put yourself in this situation for a second. You're in serious pain, you ask a simple question, when will I be seen? And the answer you get is, they plan on seeing everyone. Wow. I mean, that one single sentence, it's pretty chilling, right? It really became the heart of this entire research paper. It perfectly captures that feeling of desperation that kicked off this whole citizen-led look into the local healthcare system.
All right, so let's get into it. How does a single awful ER visit blow up into a whole public report? Well, it all starts with one guy. And it's just a fantastic example of how a really bad personal experience can actually turn into a call for public action. Okay, let's just walk through what happened here, step by step. He gets to the ER at 1:50 p.m. and he's in what he calls 8 out of 10 pain. That is serious. They do the initial check-in, draw some blood, and then send him right back to the waiting room. An hour goes by. He's in so much pain he's literally lying down on a bench. He asks a nurse for help, nothing. He asks a security guard, gets an excuse about ambulances. It's not until 5 p.m., we're talking 3 hours in, that he gets that unbelievable, "we'll see everyone" line. And by 6 p.m., after more than 4 hours with zero treatment, he just gives up. He leaves to go take care of it himself at home.
And to really get why this was so urgent, you have to understand the backstory. The man who went through all this has Crohn's disease. Now, that's a chronic condition, and when you have a flare-up, it can cause agonizing pain. It's the kind of thing that requires immediate IV medication. So this wasn't just some minor ache or pain. This was a full-on medical emergency.
Okay, now let's switch gears for a second and look at the hospital system's official stated values. This is Sutter Health. On paper, they talk all about compassion, teamwork, integrity, and excellence. Things like prioritize patients' care above all and behave ethically and honestly. Sounds great, right?
Well, here's where the rubber meets the road. This quote from the researcher just lays the disconnect bare. He wrote that after that day, the trust he had was, quote, non-existent, and that there was no integrity. I mean, that's about as big a contrast as you can get between the values you see on a website and the reality of what someone actually experiences in a waiting room. But here's the thing. This story doesn't just end with him being angry and writing a complaint letter. Not at all. He took all that frustration and immediately funneled it into something really structured, a formal response aimed at actually making a change. So let's see how he did it. And he was super methodical about it. I mean, the very next morning, he sat down and documented everything. Then, he mailed letters straight to the top, the president, the CEO, all the senior leaders at Sutter Health. And if that wasn't enough, just a week later, he went to the Tracy City Council meeting and told his story during the public comment section, putting it all on the public record and promising to start this research. And the goal of his paper, the objective, was actually really clear. It wasn't about pointing fingers or blaming one specific hospital. The whole point was to start a real conversation about healthcare in the area, to use his own story plus a bunch of public data to get all the right people, the leaders, the hospitals, and the community talking to each other.
So with that goal in mind, the research zooms out. It goes from this one personal story to a much bigger picture of the entire local healthcare system. What does it actually look like for the people who live there?
And that brings us to the big question the research tries to answer. Who is serving the 142,000 residents in what they call the Greater Tracy area? We're talking about Tracy itself, plus Mountain House and Lathrop. That's a lot of people. So who's taking care of them? This map gives you a pretty good bird's-eye view of the whole situation. You can see how the hospitals are kind of clustered in different spots. You've got the Tri-Valley and the Bay Area over to the west, then Stockton and Manteca up to the northeast, and then smack in the middle, you've got Tracy. So if we zoom in a little closer, the research points to 4 main hospitals that have emergency rooms, all within about 15 miles of downtown Tracy. For those 142,000 people we just talked about, these are pretty much the go-to options. And here's a look at 2 of those key players. Over on the left, that's Sutter Tracy, the very hospital where our story began. And on the right, you've got San Joaquin General Hospital, which is another huge provider for the whole county. You can think of these as 2 of the main entry points to healthcare for everyone in the region. Okay, so this is where the research really shifts gears. It moves away from the personal story and gets into the cold, hard data.
It starts digging into the numbers, comparing how many people live in the area versus the resources they actually have, specifically how many hospital beds are available.
And this is where it gets really, really interesting. The research looked at the ratio of people to what are called acute care beds, the beds for serious short-term conditions. Now, on this chart, a bigger bar is actually worse. Look at Sutter Tracy. It's got about 1 bed for every 1,400 residents in its immediate area. Now compare that to its neighbors. San Joaquin General has 1 for every 750 people, and John Muir over in Walnut Creek, 1 for every 600. The difference is pretty stark.
And just to put that number into perspective for you, take a look at this map. This little 5-mile circle around Sutter Tracy, well, there are an estimated 105,000 people living inside it, and all of them are relying on a hospital that has just 77 of those acute care beds. And the whole picture gets even more complicated when you zoom out just a little bit. That cluster of 5 hospitals up in the Stockton, Lathrop, and Manteca area, they're trying to serve a combined population of around 440,000 people. That's a huge number. And here's the really crucial part. These hospitals aren't just serving their own little towns in a vacuum. There's a ton of overlap. People are moving between these areas for care, which means patients and resources are being stretched really thin across this huge, interconnected, and fast-growing region. It puts a massive strain on the whole system.
The research also found a pretty significant gap in coverage. Take the community of Mountain House, for example. It's got about 30,000 residents, but get this, there's no local hospital with an emergency room. So if you live there and have an emergency, you've got no choice but to travel to Tracy or maybe even farther.
So after laying out the personal story and all this regional data, the paper finally gets to its main point, its ultimate goal. It's time to start a real community conversation.
Now, the paper is really careful about this. It frames its conclusion not as some final judgment on a specific hospital, but as a bigger question, a question of scale. Is the healthcare system they have now, which, let's be honest, was built for a way smaller population, is it really ready to handle the massive growth that's happening today, not to mention what's coming tomorrow?
And all of this leads to a very clear call to action. The number one thing this research is asking for is a formal healthcare summit. The whole idea is simple, really. Get all the key people into one room. We're talking city, county, and state leaders, hospital executives, and most importantly, the public, and just have an honest conversation to plan for the future.
And really, that's what this whole thing boils down to. It leaves us with this one big, thought-provoking question. And it's a question that doesn't just apply to Tracy, but to pretty much any community that's growing. As more and more people move in and needs change, don't we have a responsibility to press pause and have a new, really serious conversation about what the future of our healthcare should look like?